In this video, I will be discussing a hidden cause of heart attacks that is rarely talked about. This reference is taken from a book titled Hidden Epidemic, authored by Dr. Thomas Levy, a renowned American cardiologist known for his research on the link between dental health and systemic diseases. In his research, Dr. Levy presents data on heart patients and reveals an interesting connection. He states that out of 101 patients who experience myocardial infarction or heart attacks, 78 show DNA of the same pathogens and other germs typically found in root canal infections. This is quite a surprising finding. But the biggest question is, what are these pathogens doing in the heart? How do they end up there? And what is their connection to your heart health? These same pathogens were also found in the bodies of people who suffered strokes or paralysis when their blood clots were tested. More data revealed that these individuals also had infections in their dental roots. Interestingly, they were completely unaware of these infections as they didn't experience any symptoms. This type of infection is known as an abscess, and it can be so dangerous that it may gradually destroy the bone beneath the affected tooth. According to Dr. Thomas Levy, what makes this infection particularly harmful is that such long-term chronic infections or inflammation can lead to numerous other health problems, not just heart diseases, but also conditions like arthritis, chronic fatigue, and other inflammatory diseases. This condition is quite common and is called periodontitis. Typically, there are no visible symptoms for this condition. If you get a 3D scan at your dentist's office using cone beam technology, it will scan the roots of your teeth. However, this technology is not yet very common and is available only at select places. There is also a blood test that checks for the presence of C-reactive proteins, which increase when there is an infection in the body. You can consult your dentist for such tests. When you chew, you are inadvertently pushing these bacteria further into your lymphatic system, which is a part of your body that protects you from diseases. If this system becomes compromised, your body may experience swelling and infections. Dr. Levy further mentions that nearly 25 million people worldwide undergo root canal treatment every year. According to his data, the root canal procedure is often the root cause of this issue because during this treatment, the internal part of the tooth, known as the pulp, is removed. This pulp contains nerves, blood vessels, and soft tissues. The tooth is then sterilized and filled to prevent reinfection. The issue arises when, during this process, the tiny canals inside the tooth, known as tubules, get damaged or even removed in some cases in an attempt to completely clear the infection. These tubules are a vital part of the tooth structure, and it is in this area where disease-causing pathogens can attack again. Even if someone has chronic inflammation or has been dealing with a dental abscess for a long time, it's unlikely that a single procedure will completely eradicate all the pathogens. The infection can reside in the tooth, gums, jawbone, or even the tonsils. This chronic exposure to pathogens occurs when they repeatedly attack the body, especially when your immune system is not strong enough to combat them. These pathogens cause oxidative stress in the body. Oxidative stress is a condition in which an excess of free radicals accumulate in the body, which can occur when there are insufficient antioxidants available to neutralize them. You might be surprised to learn that there are over 500 different types of bacteria, viruses, and fungi in our mouths. As I mentioned earlier, toxins and harmful substances are byproducts of these pathogens. Due to constant infections, the body is in a constant state of immune response, fighting off these pathogens. Over time, the body may even begin to form blood clots, which is a mechanism for dealing with ongoing inflammation. Common symptoms of this include fatigue, joint pain, gum pain, and tooth sensitivity. If we assume someone has this infection, they may experience slight fatigue daily, feel unwell, and have weakened immunity. However, they may not be aware that the source of the problem is an infection in their teeth. A simple way to address this is to start taking 1 to 2 grams of liposomal vitamin C daily. Liposomal vitamin C is an antioxidant that can help reduce oxidative stress and the damage caused by it. This is a simple approach that can help improve your immune system and your overall health, especially if you're feeling fatigued. The key benefit of liposomal vitamin C is that it can penetrate deep into the cells and work effectively within the body. I recommend taking 500 milligrams of liposomal vitamin C 3 times a day, as it is water-soluble, meaning it will continue to circulate throughout your body and work effectively. Another advantage of liposomal vitamin C is that, unlike regular vitamin C or ascorbic acid, it is less likely to cause diarrhea. It strengthens your antioxidant network and helps reduce oxidative stress in your body. If your symptoms improve and you feel better, it means you are addressing this issue more deeply, and you can determine whether it's related to your diet, lack of sleep, excessive exercise, or possibly a dental infection. This was a brief overview of the topic. Take care, and I will see you in the next video.